So I love this next sequence of stretches for all of the ladies that are trying to get back to perhaps a little bit more mobility after having baby, some painful symptoms in the lower back, maybe some painful intercourse as well, or anybody who is feeling some heaviness in the pelvis as well. Maybe we're thinking we have a mild prolapse going on, or maybe some heaviness toward the end of the day felt in the pelvis. These exercises seem to relieve some of those symptoms, make you feel just a little bit better, a little bit more prepared for whatever activity you need to do. So I tell my gals to get really close to the wall. They're going to lay down on your back. You're going to get your bum really close to the wall. Take a little pillow just so you get a little bit of elevation, and maybe you can protect your sacrum a little bit as well, because often after having baby you have some tailbone pain. So you put it down on the ground and you get as close as you can to the wall, okay? And this will be different for everybody, so don't worry about it. If you can't get super close, that's fine. And then you start off with just bringing your legs up this way, allowing gravity to help with circulation, with some stretching of the back of the legs, the back of the hips and the glutes. It'll get some of the connective tissue in your lower back as well. Just kind of prepares you for some movement, and it's pretty gentle as well. I then I just go ahead and start pumping my ankles up and down like so to get a little bit more circulation, some dynamic stretching as well. It helps us stretch our sciatic nerve also, which runs all the way down to our feet. And it helps decrease some tension of that just nerve in general and all of the muscles and the tissues that it passes. And so doing maybe 10 to 20 of these, whatever you feel like you can tolerate. Maybe if it's your first time, 10 should be good. And that's 10 on each side, okay? Then you do some heel slides here, okay? This I really like because it's very rhythmic, and it does help kind of calm down our nervous system. So if we're feeling a little anxiety, a little stress, all of those stressors are going to show up somewhere. Sometimes they show up in our lower back, sometimes they show up in our pelvis. So doing this helps decrease some of that tension. It helps calm our system down, and it's very, very gentle as well. And it's a little bit of exercise, and sometimes this is what we need to do to just kind of start after having baby. You don't know exactly what it is that you need to do right away. This is a good little tiny, stretch and just a little bit of exercise, okay? So then the next one is what we call lower trunk rotations or windshield wipers, side to side. This is also rhythmic. This also helps decrease some anxiety. It helps with range of motion of your back. It helps with range of motion of your hips. And because gravity is still helping, if you have a little bit of that prolapse, that heaviness in your pelvis, this will be helpful in just kind of helping the organs reset a little bit, be a little more snug within our pelvis, for lack of a better word right now. It's not fixing things, it's making things feel a little better. It's making things feel a little bit more comfortable. It's helping decrease that tension and that pressure that we feel throughout the day. So 5 to 10 of these, whatever you feel like you can tolerate. And then you open up your feet and you do some wide leg windshield wipers here, okay? This is going to bias your hip a little bit more, okay? You can even open up your arms like so that you get a little bit more of a stretch. The front of your chest, your pectorals. It'll help you breathe better as well when we're hunched over or when we're stooped over. That adds pressure into our abdominal cavity. So we get what we call that intra-abdominal pressure, and that can be a bit of a problem because that pressure needs to go somewhere, and usually it goes to our pelvic area. And if you've got it there, if you've got it going there, but you don't have perhaps the support yet because you just had baby or because of whatever, it may cause or may lead to things like urinary incontinence, maybe some pelvic pain, maybe even feeling a little bit more of that prolapse, okay? And then you bring your feet together, then you do a little bit of a stretch right here. And this is the one where I like to tell people, just take deep breaths in through your nose, out through your mouth. And when you breathe out, you want to pretend like you're deflating. So you want that breath to be very, very long. When you breathe in, you want to just picture yourself or your ribs as a barrel, and you want to open up that barrel in equal area or equal parts. So try to really expand that rib cage at the front, on the sides, and the back. And then breathe out through pursed lips, really nice and gentle and fully out. And then straighten out your legs. Just kind of hang out there for another few seconds. These stretches shouldn't take more than 5 minutes, so it'll give you plenty of time to be able to do whatever else you've got going on. But it does decrease that stress, that tension, and gets us prepared for a little bit more mobility and just overall improves pain.